let's move on. The next topic I wanted to cover was an interesting one of previously treated patients without molecular selection, without a specific target, who are treated with the targeted therapy. This one is called Patritumab Deruxtecan, and it is a so-called antibody drug conjugate. So it's kind of a smart bomb. It is an antibody that delivers a standard chemotherapy as a so-called payload attached to it. And it just attaches to the target, because that's what this antibody goes after so well. Its particular target is called HER3. It is in the same family as HER2, which is a common target in breast cancer, also looked at in and some utility in lung cancer. And EGFR is HER1 is another name for it. It's in the same family. Now, HER3 is expressed on 83% of non-small cell tumors and associated with less favorable outcomes. This is not a huge study. This was 57 patients. Without an EGFR mutation, we'd actually seen results with this agent in patients with an EGFR mutation, and it had the response rate in the high 30% range as presented at ASCO last year. What we saw in this study was results in two cohorts. They showed those with some kind of driver mutation on the top here as a waterfall plot, and in the bottom, those without any driver mutation, which is lots of our patients, and no clear difference that this targeted therapy given in a really untargeted way had a response rate, significant tumor shrinkage of about 40%, close to that, median progression-free survival of over 8 months, and side effects that were not particularly prohibitive, largely low blood counts, which we get with a lot of chemotherapies and are very comfortable with, sometimes low potassium and fatigue, and relatively low rates of not very serious inflammation in the lungs. So interested in your thoughts of whether this was particularly exciting to you. This was the poster discussion. It was not an oral session, but Gilberto, what are your thoughts about this agent, this setting, and the concept of giving targeted therapies in an untargeted way?
Would it be interesting to see if the patients did express HER3? Sure. But if it truly is positive in 80% of patients, I think it's very reasonable to take the approach that they did. As you mentioned, we have seen a decent response rate, if not stellar, in patients with EGFR mutation. I think that this is valid. It's certainly very early, but it is a positive signal that we should move this forward. Beyond that, not sure I would comment with a lot of intensity in terms of thinking if this will become something or not. When we look at breast cancer and look at low HER2, so not positive by the usual standard test, which is FISH or immunohistochemistry, very strongly positive, we have seen that a different antibody does seem to have very good response rate and helps patients live longer. So putting all of those data together, yes, so this is promising, but we definitely need to study it more before we can start thinking of it as something we should use in clinic.
And this is something that nobody was suggesting should be our practice-changing approach right now. But Jarushka, what are your thoughts on this? Was this, counterintuitive to the whole tenet of precision medicine? This is not precision medicine, but is this something that you see as a valid and potentially attractive application?
I think that antibody drug conjugates are hot right now. And I think that is what this might be building off of, that this construct is something that we're very excited about. And we have seen activity of this sort of class of agents in other settings that has led to some of this excitement. And maybe, that is where this analysis sort of came from. I do think it's a little bit counterintuitive in terms of the population it's looking at. Previously, there was a presentation of this agent in EGFR mutant lung cancer in the post-TKI setting, and knowing that this may be a resistance alteration that occurs in a subset of patients, that makes a little bit of biologic sense. So here, I guess I didn't think that it was perhaps the most interesting from that point of view, but I think in terms of the other settings, certainly something that we would be interested in hearing more about.
Excellent. Thank you.